Have a good day, everybody. Despite all the obstacles, I'm glad to be here as we share with you some information about the tech art therapy application in the management of wounded people rehabilitation. And I will try to the same to check the presentation. Let me introduce myself. My name is Andriy Polomarchuk, and I'm proud to be here as the Chief of Medical Rehabilitation Program, Kiev Institute of Rehabilitation. Um, we plan to be offline together with you at this time, but unfortunately, due to reasons beyond our control, I'm forced to present our work online. So anyway, I'm so appreciate the Winback team for this opportunity to be here online and share with you our achievements. Shortly, I want to tell you briefly the story about the rehabilitation development during 2024 here in Ukraine. I will take responsibility myself to even describe its development within the country during this time. During the difficult 2022 year, the phases of the restoration medical rehabilitation field since the beginning of the war from the February 2022 began to appear at the beginning of May 2022. Until May, all the possibilities of medicine have been directed to the development of first aid and surgery. And the first institution that began to provide medical rehabilitation assistance, where 99% is a private. That is the private initiative is the force that reviewed that industry and country continues to develop it. A short conclusion of this period, the state structure of medical rehabilitation that was built before that didn't withdraw this challenge because it was not built correctly. In 2023, the number of patients for the war reason is increased. Only at the beginning of April 2023, hospitals with the high quality inpatient rehabilitation began to appear. And they were also based on the private initiatives. But till now don't have exact structure of wounded people rehabilitation. And finally, during this year, on the one hand, the field of rehabilitation is constantly developing. On the other hand, in many ways, it develops not quantitative, but just the continuous, just the not qualitative. And this used by those state institutes that were engaged in until 2022. And it again becomes threatening for us. Populism in medicine is becoming more widespread than professionalism. In 2024, the trend that can be clearly traced from the Ministry of the Health of Ukraine is the rejection of any methods of the hardware physiotherapy in medical rehabilitation, and still doesn't have understanding in providing qualified stage medical, physical, sports rehabilitation. And this is not necessary for critically faster recovery of patients, especially military personnel. Therefore, using this opportunity, I want to share with you the observation that we notice in our practice using combination of physical, medical direction in rehabilitation. In other words, we call it intensive medical rehabilitation approach. And yeah, like this. I don't know why just this slide just so quickly go through. In possibility to choose from the large number of procedure, currently we are talking about the hardware physiotherapy. should be considering from the point of view of variability in the rehabilitation approach. What may work for one patient may not work for another patient. And we combine the main three direction in our clinic. The first branch of it, the first just the step, is a branch of the physical interventions, the physical therapy. The second one, which are present the front of you, many approaches about just the hardware physiotherapy. And third one, the medication, the pharmacy. Of course, the whole of this glued together by the psychological just the healthcare, which help to cover just psychological issue, the patient, and psychological issue of the team, rehab team. Another one, we are separate just the gait training for the patient with the empathy and ergotherapy. In any case, the understanding that are we doing the right things, we are on our place, we like to it because it helps us in our daily hard work. And short video, for the first short video, I want to show you, or then just the physical issue on the first place on our rehabilitation the programs. The second one, the variety of patients is different from the kids and from the military persons and from the age persons, and is hard to maintain just the normal mood into the in the clinic. But anyway, we are trying in this huge hard cases to do just the better what we'll do. And this is video, you would see just the how just the complement, how many just the patients on the small place to get the rehabilitation. And the fourth video, I want to share with you our decision, the short view video, when we are start rehabilitation with two legs amputees, the patients. And our goal in this case was just to learn this guys to the running and rehabilitation, the finish when this patient starts running. Okay, next slide, next one. Many international media, there's some benefits which we cover during our work. Then many international companies made report stories, news about the clinic, about our patients. It was a huge experience for us personally and for the spreading real information about what is going on in Ukraine. And yes, we are planned to write for us this the short our like the goals which we cover during the small 2 years period. Then our rehabilitation clinic completely is a private partnership established. Right now, average 84 and more visits at patients undergoing medical and physical rehabilitation daily. We have begun from just the time period of the clinic from the 9 a.m. to 2 p.m. And right now we have the 2 shifts from the 7:30 to 6 p.m. And the number of patients who want to receive rehabilitation care is increasing every month, but our capabilities are limited. And we are trying to find out opportunities to open inpatient care. Our goal in 2024-25, maintaining the high level of combination and intensity of physical, and medical management for the fastest possible rehabilitation of wounded persons. Military the first performance of their military duties, civilians for the active social life and businesses. And we're still looking for financial support for the transition from the outpatient to the inpatient rehabilitation. And only in 2023, we had the opportunity to send one specialist in physical therapy for training. It was just the training course in Romania, and then implement this type of therapy in the complex rehabilitation. At the beginning of the implementation of TEPAR therapy in practice, we use it with the gun. It's like the monophysiotherapy. In these cases, the role of the CAR therapy is considered as the preparatory to the main procedures or as the auxiliary one. And you see just the direction of which we choose for just the rehabilitation physio management. It's prevention of scarring after dermatoplasty, quantum pain management, and peripheral neuropathy. During the short period, we wish, but with such difficult diagnosis like the polytrauma, it's necessary to take into account a lot of components that, in addition to the therapeutic ones, may have a secondary, but still not desired effect. And here, I show you just the some, oops, 1 second, some example then to give us the side effect when just the peripheral nerve was involved into the stimulation. Yeah, there we go. Now you would see just the arm, how just the nerve involved into the process of the TECAR implementation. And second one video, the same patients, okay, from another view, you see just the second finger, how just the second finger involved into the process of stimulation. Okay. For this reason, oops, my slides, so we go through one, yeah, like this. For this reason, we make decision then to begin combine effect the TCAR therapy with the another interventions. And most combination, most direction which we used and we using it right now, this passive motion with the active motion, with the gait training, and with the manual therapy, When we talk about just the firstly, when patient arrived after just the surgery, okay, and arrived for the clinic, first of all, we are trying, here is the example with the knee joint, we need to increase the range of motion, the some joint, and the specialist with the TECAR therapy get impact for the ligaments. Next, I explain you just we don't have exact right now for the 100 effects for the how it's decreased the time of rehabilitation with the ligaments, but we choose some diagnosis like the muscle contractures, and with the muscle contractures, we get the more positive effects for which are decrease the time of rehabilitation for the patient. Next two examples with the active motion. Here is the Tachycardia therapy with the active motion. And here the short one, the same with another view, okay, with the complex, with the flexion and the supination of movement. And the third one, the effect for combination, the TCAR therapy with the gait lab, when we also just the goal, our goal, just using TCAR therapy with the gait lab, also then increase but the phase of motion, phase of gait. We have just the eight phases, and depend of the phases which are suffer, just the physiotherapist prescribe the TCAR therapy in those cases. And last video, the combination with the manual therapy with the physical therapy, also 2-in-1. The same example. But it's also just the workability with the ligaments, with the joints. Right now, I'm not ready to share with you just the information about the ligaments. We are trying to find exact the cases which are decreased just the time of rehabilitation. But for this presentation, I want to share with you, I want to show you just the video with the um, presentation. Okay, with the two cases. The first case, for the clinical case, first clinical case, the patient, 25 years old, the female, diagnosis, consequences of mine exploder injury, blind shrapnel injury of the right thanks of the exact the muscle rectus femoris. And the rehabilitation began for the 5 days after surgery. Gait, patient arrived to us with the crunches. Just she couldn't just go through the helpful. The patient felt pain during tension of the rectus femoris muscle, and during observation we found the knee joint range of motion flexion was at 38 degree into the right knee joint. For the first week, we have prescribed the passive range of motion, divide the passive covered by the Artemor, and it's covered 1 hour every day without just the Sunday, 6 days per week. Once debridement, laser therapy about 20-30 minutes every day. Also, every day we've got just the 1 ounce dress. It was this several days when it needed to do this twice per day. And during 1 week, we are got just the knee joint range of motion, the about the flexion 12 degree plus 12 degrees, like the 50 degrees per week. For the second week, during the second week, just the program is changed for the passive range of motion, the same one debridement laser therapy 20-30 minutes every day, and we are prescribed the TCAR therapy without the leg movement. For the two separate area, for the upper and the lower part under the wood, under just the big, huge the wood field. Also add the physical therapy with the both ankle joint, 30 to 40 minutes every day, but it was the ankles. Then don't disturb the knee joint. The same prescribe the round dress every day, and you see just the knee joint range of motion critically increased for the 37 degree during just the week, during just the second week. And the yeah, here we go. We have just the video. Okay, how we implement the car therapy for the dress for the wood. Okay, next one. During just the third week, during the third week, active range of motion with steka therapy. Okay, about the 20-25 minutes every day. Still now the wound debridement laser therapy 10 minutes every day. Physical therapy with the both ankle joint 30-40 minutes every day. And the knee joint range of motion flexions is covered 122 degree. Here we have just the video. Previously, this kind of the patients to cover us about the 3-4 months of the course rehabilitation. Right now, it's less than 2 months. Less than 2 months. Okay, here we go. And the intermediate slide, you see just the wound area comparison before rehabilitation beginning and the end of the third week. You see just the how to change the wound area. And all of interventions in these cases, in this case, without any pharmaceuticals, only physical physiotherapy, and that's it. And the fourth week, the active range of motion with the Thakor therapy, about 20-25 minutes every day, and the physical training for another muscle, for the muscle of the core, for the muscle for the arms, we added, and will begin just the for the first during like the first week, the gait training. Also the gait training with the combination car therapies. Here we go. It's so important for us to evaluate the length of the steps and just the force of the steps and the speed of the or velocity of the gate, because the our finish line based on onto the um, based on onto the running. You see the patients walk just the continuously without the crutches, and the maximum walking speed is approach 5.5 kilometers per hour. Kilometers per hour. This is the use. And we have finished the case study management number 1. And shortly, the case study management number 2. We previously showed this case in the previous meeting with France. The patient, male, 29 years old, with the diagnosis post-traumatic multiple mononeuropathy of the left ulnar, medial, and radial nerves in the form of deep paralysis of the flexor and extensor muscles of the hand, moderate pain syndrome. This is the view patients which arrived for the clinic. You see just the Raffles present. And 2 months post-surgery rehabilitation, but totally, it took about the 3 months. You see just the differences before and after rehabilitation course. Here we go. Shortly, just the conclusion which we have during just the our presentation. The usage of the TCAR therapy preserves the thermal effect of soft tissue better and longer during the muscle contracture management. In case of polytrauma, usage of TCAR therapy should be very careful due to different structural changes in the soft tissue. In combination with the passive and active physical exercises, wound rehabilitation course is significantly reduced. At this point, thank you very much, guys.